intraoperative aspect of breast surgery is the reduction of capsular contracture. So capsular contracture, let me grab my trusty implant here. When an implant is placed inside the body walls it off with a Ziploc bag of scar tissue. So it looks exactly like a Ziploc. It's like 1/10 of a millimeter thick, very strong. So it totally lines, the body totally lines the implant. It's not rejecting the implant. It is just saying, hey, this is not me, and so it kind of walls it off from itself. It used to be about 15-20% of the time that scar tissue could tighten around the implant, and it basically draws the implant up on the body. It can get very firm and create a lot of asymmetry, and in really severe cases, pain. So about 15 years ago, 20 years ago, we started really researching capsular contracture. What we found, it's due to one of two things. One, either blood or fluid in the pocket around the implant. So we do the surgery again without any bleeding, so it should reduce that chance of that being a factor. The other is a low-grade bacteria. So we do about 14 things to prevent capsular contracture. It costs our practice about $300 or $400. It's super important because before, we've lowered the capsular contracture rate now down to less than 1/2 of 1%. So we have to do these things though and jump through these steps to reduce that extra scar tissue. Those really include triply prepping the skin. We put nipple shields on because we can culture bacteria out of 85% of women's breasts. We irrigate the pocket. It's completely bloodless, so there's no blood that can cause this problem or extra scar tissue. We irrigate the pocket with antibiotic solution and some dilute betadine to sterilize the pocket. And then probably most importantly, we put the implant in with a sterile funnel or sleeve. We take the implant right out of the box, put it into the sterile funnel. I think we also have that on our website, where we basically propel or push the implant through a small little incision without touching the skin. So all those things are really important because to treat capsular contracture is an option. We have some pretty good ways to treat it, but the best way to treat it is to prevent it. So the treatment of capsular contracture is super important.